Brain Doctor Speaks. 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 Yeah, Brain Doctor Speaks. This video is for entertainment and contains the opinion of Brain Doctor Speaks. Anyone watching should always consult the advice of their own primary care physician or specialist for diagnosis or treatment.
Hi everyone, I'm Brain Doctor Speaks, and I have some information that I would like to share to you today. And also some housekeeping information. If you like this video, please subscribe, click the like button, click the notification bell, and share the video. Thank you. So today I would like to talk about neurology, the specialty of neurology, and what a neurologist is and does. I am a board certified neurologist, certified by the American Board of Psychiatry and Neurology, and I now have been in practice for over 15 years. And so a lot of times a lot of people really do not know what a neurologist is. And in fact, whenever someone asks me what I do and I tell them I'm a neurologist, then a lot of times people say, oh, that's a hard one. And then they'll also say, oh, brain surgery. And so I have to tell them, I said, no, I don't do surgery. And so sometimes, and many times, people will say, well, so what do you do then? And I always find that pretty humorous, but I have to understand that most of the general population really does not know what we do in neurology. So neurology is not a surgical subspecialty. Neurology, by tradition, is a subspecialty of internal medicine. And what I mean by internal medicine is the branch of medical care where physicians technically treat adults with general medical problems such as high blood pressure, diabetes, high cholesterol, those sorts of things. And in today's world, in particular, internal medicine physicians, or internists as we usually call them, who typically work on the outpatient side in an office as opposed to a hospital, they also coordinate the care of their patients. And look at their patients in a whole to make sure that all of their medical issues are being addressed and that there are no conflicts between what various specialists are doing to treat those patients. Just like internists do not do surgeries to treat their patients, neurologists do not do surgeries to treat their patients. So for instance, if someone has a brain tumor, and one that needs to be removed, a neurosurgeon does that. Well, a neurologist may treat that patient if the person has seizures as a result of their brain tumor, or may treat their headaches if they have headaches as a result of a brain tumor. Because even if the tumor is removed, that person can still be prone to have seizures. They can still be prone to have headaches. So I hope that better clears up what neurologists do as opposed to neurosurgeons. And so I actually have 5 different things to discuss about what neurology is and what neurology does. So number 1, a neurologist is largely based on clinical diagnoses. So what I mean by that is we don't just come in and speak to the patient for a few minutes and then order a series of tests, and then those tests automatically tell us what is going on with the person and gives them a diagnosis. And then the other 4 points that I would like to make are that neurologists treat people with certain brain conditions, certain spinal cord disorders, certain nerve conditions, and certain muscle diseases. So let's go back to point number 1. So when I talk about how a neurologist is mainly provides clinical treatment, what I mean by that is we largely go on taking an extensive history from the patient, and then we come in and actually do a thorough physical examination, and more specifically a thorough neurological examination. And then we may order some tests which can help prove or disprove the possibilities that we think are going on with a patient to help us get to the right diagnosis. So a lot of times when people come to the doctor, they assume that, okay, I'm gonna see the doctor. I'm gonna tell them a few things. They're just gonna ask me a few questions. They're gonna do some tests, and voila, here's my diagnosis. Well, a lot of that can't just be found on YouTube or Google. So in this day and age of social media, a lot of us think that we can get on, just Google something, and that it's just we're gonna type in a few symptoms and that's gonna tell us what's wrong with us. Well, I'm gonna be honest, folks. If that were all it was to it, I would not have had to have done 4 years of college, 4 years of medical school, and then 4 years of residency training. Meaning, when I graduated from medical school, I was considered an MD, a doctor of medicine, but I couldn't practice medicine because in medical school, we all learn the same thing. Traditionally, during the first 1.5 to 2 years of medical school, we all take basic science course. So biochemistry, gross anatomy, and then we may go into other things like cardiovascular diseases. Number 2, neurologists treat brain conditions. Such conditions include things such as strokes, headaches, multiple sclerosis, and Parkinson's disease. Again, as a non-surgical specialty, I prescribe medications and other techniques to treat people's headache. I prescribe medications to treat epilepsy. Epilepsy is somebody who has a recurring tendency to have seizures. I also use medications and other techniques to treat conditions such as Parkinson's disease, by which the great majority of those patients would not be candidates for surgery, and also to help manage dementias like Alzheimer's. Number 3, neurologists treat spinal cord conditions. So possibilities or things that cause spinal cord problems are spinal cord related injuries, such as from sports like football, or from a car accident, or from fall. And people have various different symptoms related to spinal cord disorders. So they can have problems with weakness in their arms and or legs. They can have pain, body pain, and they can have stiffness and spasm. All of those things by which would not be typically remedied by surgery. And so now we're at point number 4. Neurologists also treat nerve disorders, for more medical term, neuropathy or peripheral neuropathy, and that can come in various forms. So one of the most common types of neuropathy or nerve damage is diabetic peripheral neuropathy. This is when nerves furthest away from the trunk of the body, so starting typically in the feet and if progressing up, will go up to the knees and then can even go to the hands. Well, this is a condition that can be quite debilitating because people can have numbness where they cannot feel their limbs very well. They can have balance problems, and most commonly, people know that it can cause various types of pain in one's limbs. So that's another major condition that we as neurologists treat. And diabetic neuropathy is just one example of what can cause a neuropathy. And then point number 5, neurologists also treat certain muscle conditions. With certain muscle conditions, by that I mean that there can be things that can cause damage to muscles themselves. So for instance, people can have certain metabolic problems like thyroid issues that can affect their muscles. They can have inflammatory or autoimmune conditions like lupus, for instance, that could attack their muscles. And then they can also have, even sometimes from medications, that can cause problems with muscle. And so in addition to frank muscle diseases, there are also other conditions such as ALS or Lou Gehrig's disease that can affect the connection between the muscles and the spinal cord and or the muscles and the brainstem. I can elaborate on some of these conditions in future videos. I hope this information was helpful to you. We'll see you later. And again, as a reminder, if you like this video, please subscribe, click the like button, click the notification bell, and share the video. Thank you for your time.